All right, good morning, everyone. Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractic physician at Gatesway Health. Today, we're talking about concussions and the blood-brain barrier. Kathy and I are going to be doing a series on concussions called Why Post-Concussion Syndrome, and we're going to go through a number of features of physiology as to why somebody has a head injury and they don't heal. So, good morning, Kathy.
Good morning, everyone.
All right, so go ahead and let us know what you think about this.
Let us know, what is the blood-brain barrier, or BBB, and why are we talking about it?
So we have to get blood into the brain, and we have to get things like glucose, we have to get oxygen, we have to get other micronutrients into the brain tissue. Many of you who take pharmaceutical medications for the brain will have some awareness that, oh, well, this medication does cross the blood-brain barrier, whereas other substances do not. What does that really mean? It means that as your blood vessels go into the brain, you have big blood vessels like the carotid artery. Well, the carotid artery will become other little arteries, and then there's smaller arteries, and then eventually little arterioles and capillaries. Well, with the capillaries is where we're going to exchange things like glucose and oxygen into the cerebrospinal fluid. But at the level of the capillary, there are other things surrounding the capillary bed, things like astrocytes, glial cells, they're called pericytes. And these other little cells kind of form, if this was the capillary, they're kind of like grabbing onto the capillary to create a barrier around it so that big molecules don't diffuse right into the circulation. Does that kind of make sense, Kathy?
Yes, it does.
We have a little bit of an echo. I don't know if it's my phone or not. So let me see.
I've gone into a very tight room, so nothing should be doing anything.
Oh, it sounds good on your end. Yeah.
Okay, so why is this important, and also why is it difficult to accept the integrity of the blood-brain barrier?
It's important because in the quest, I would say since around 2002, 2005, to figure out why some people with head injuries never seem to recover, researchers have started digging into this, trying to figure out what happens in the brain of someone who has a concussion. And they were doing studies in college football athletes, and they found that they could see immune cells from their body going into their brain in a way that they shouldn't immediately after a football game, which indicated that this blood-brain barrier was in fact breaking down, and these immune cells were getting into the brain tissue, creating more inflammation. So that was one of the first seminal articles, I will say, that I saw on the blood-brain barrier as a potential cause for something like post-concussion syndrome. Because again, the question is, why do a lot of people get a head injury and they're seemingly fine? Some people have horrible, severe head injuries and they come out seemingly with no consequences, where other people have seemingly trivial, and I say trivial in quotes because I know it's not trivial, but as I've discussed in other concussion videos, for the emergency room physician who sees somebody come in with, a bullet in their head or part of their skull missing, and that person make near a full recovery versus someone else who has a box fall on their head and they're never the same, that's where they say seemingly trivial head injury. How does that head injury then translate into someone who has chronic light sensitivity, sound sensitivity, they're dizzy, they have trouble thinking, trouble focusing, poor stamina, all of those features? That's what's led researchers to start looking at this blood-brain barrier issue, and probably some people are just more predisposed for something like that to happen.
Okay, so, yeah. I mean, is there such a thing as you're saying predisposed to be born with a weak brain-blood barrier?
I wouldn't necessarily say that. It probably traces back more to inflammation.
And goes back again to diet sometimes, from what I read.
Right. So there's a lot of research on inflammation and its effects for the blood-brain barrier. In fact, one of the classic things researchers will do to study this is that they'll inject something called lipopolysaccharide, which is a piece of gram-negative bacteria, into circulation, usually of a mouse. You don't want to do this in humans. And then they'll watch the blood-brain barrier and they'll see that it breaks down. Well, as Kathy and I have talked about, a lot of the evidence regarding diet and what's happening with America in terms of inflammation is actually the diffusion of LPS, lipopolysaccharide, from gram-negative bacteria from the gut into the bloodstream. So I would argue, yes, that maybe there is some level of compromise in the pre-existing state for the blood-brain barrier to break down. Now, I'm not saying that 100%, but I'm saying that's a possibility.
From what I read, I found it very interesting of what things can get through the BBB and what things don't.
Mm-hmm.
Nicotine can penetrate.
Mm-hmm.
Like you said, some medicines, some antibiotics, different things get through there. How does it differentiate? Is there something internally wired into the BBB that it does this to protect itself?
Yeah, it does to protect itself so that really toxic substances hopefully don't get into the brain. And I think typically, Kathy, it's based on size for the most part. So smaller molecules have a tendency to get through. Larger molecules have a harder time. And that's why lots of times when it comes to pharmaceuticals, a certain substance may be chemically modified so that then it can be transported through the blood-brain barrier or will diffuse more easily. Yeah.
And I even saw where, like, I can't think of the word, anesthesias,
mm-hmm.
which I found out with someone I dealt with who had dementia type of thing, that different, and I didn't think about it going through the blood-brain barrier, but said the people told me at the time of surgery that the anesthesia could, again, damage more brain cells for this person with dementia, and that they would try to use a different type of anesthesia, which I thought was great of them to even mention it or bring it up, but
mm-hmm.
it did seem to prove to be quite true,
mm-hmm.
that if they looked at it in this way, at least they're aware of it and they can make some precautions.
Right.
And, I mean, they can't take care of everything, but at least we're finding out more and more things that are getting across that barrier that can be detrimental to people.
100%. Yeah. And that's a good point. For any of you who have a loved one and you think that maybe their memory's going south and they're going in for a surgery, really something good to talk to the anesthesiologist and surgeon about, because it's heavily documented in the scientific literature that some people will go in for a surgery and they'll get the typical anesthesia, and maybe they had a little bit of cognitive impairment and they'll come out with full-blown dementia because anesthesia can be hard on the brain tissue for kind of, and what is anesthesia? It puts you basically kind of into a coma for all intents and purposes. So it's shutting off your brain cells. So if you're already having brain cells that are not firing as well as they should, and then you put anesthesia in there, that may cause them not to come back as fully as someone else. So.
And that takes me to another thought on, you and I have discussed muscle relaxers in the past that I used to use before I went on my gluten-free diet to take care of some of my pain. And you've used the same kind of terminology. So I'm guessing that those relaxers get through the BBB as well.
Yeah, a lot of muscle relaxers work on the neurological mechanism more than just the muscle. Yeah, totally. Which is why a lot of them have sedating side effects.
Right, and we've got side effects and can be damaging long term, correct?
I don't know if I want to say they'll be damaging long term. I don't know that I can say that for sure.
Okay.
Yeah.
All right.
Yeah.
Okay.
Yeah.
But I want everyone to understand, because believe me, I mean, I've listened to you talk about the brain, and we've never really discussed the barrier before, and the fact that there is something there to protect us from different toxins and so forth, the inflammation, that sort of thing.
Mm-hmm.
So again, it needs to be, really brought to the forefront that people are actually thinking about. Yeah, we do have protective mechanisms, but there are things that do damage it, so we need to be aware of it.
100%. And that's for any patient who has brain fog, or you eat something, you feel just kind of foggy and not feeling as well. Well, brain fog typically involves some sort of immune mechanism. Usually there's allergic or immune inflammation going into the brain tissue, and that's why people feel foggy. What does that really translate into? These are small little immune cells called cytokines, most typically, that are then going to go into your brain tissue and cause inflammation. So we can have big antibodies, which look like little Ys traveling around in your bloodstream, or little cytokines, which are just little messengers. Needless to say, that immune inflammation goes into your brain and it affects brain function, which is why a lot of you with these nebulous symptoms, I don't mean that pejoratively, but these symptoms of brain fog and fatigue, and you just can't think as well, and you just don't feel right. Well, a lot of that traces back to the immune system, how the immune system is then affecting the brain. So what do we have next?
Back around, what's the newest evidence connecting blood-brain barrier disruption to concussions?
So the article that I mentioned was one of the seminal articles, and now a new research article just came out using something called dynamic contrast enhanced MRI. And they were actually able to see that white matter lesions in the brain of post-concussion syndrome patients looked different than white matter lesions in the brain of someone without post-concussion syndrome. So from this, they're inferring that the blood-brain barrier is breaking down. The hard part about the blood-brain barrier is that it's actually hard to measure because you have these capillaries in the brain and it's hard to really see them. So we have to infer from other findings as to what's going on. Other researchers are looking at concentrations of different, what are referred to as glial proteins, and they can actually go into the cerebrospinal fluid. So you can do a lumbar puncture in the back, pull out some cerebrospinal fluid, and they see in post-concussion patients, certain glial proteins may be a little different than those without post-concussion syndrome. Now, is that clinically feasible? Probably not, because how many people with post-concussion syndrome say, hey, I want a lumbar puncture, which, you know, is a needle this long stuck into my back so that we can for sure say I have post-concussion syndrome, which goes along the line of how with post-concussion syndrome, so much of it at this point in time is we're trying to validate this condition. We're trying to give somebody some concrete evidence to say, yes, we see what's wrong with you. So researchers are also looking at something I've talked about before, referred to as diffusion tensor imaging. Diffusion tensor imaging will look at the white matter tracts. It's always backward here. So your brainstem has a lot of white matter tracts. That's why I'm pointing to the brainstem. And this part of the brainstem, for everybody who's watching, is called the midbrain. And a lot of concussion patients and post-concussion syndrome patients have light sensitivity, sound sensitivity. They have visual issues. And so they started saying, well, this area of the brainstem called the midbrain is where we have a lot of these processing centers. This is where a lot of that information first goes from your eyes into the brain. And so they said, well, let's look at this area. So I think it was the University of Rochester in New York. They studied their football players and they did imaging on them before the season and after the season. They saw unequivocally that the right side of their midbrain, which is right there, the right side of their midbrain, was affected and the white matter was affected. And I believe they also saw some abnormalities in blood-brain barrier function. I can't remember how they tracked that. I can't remember if it was from beta amyloid or not. But anyways, this was pretty important because now we're getting more and more evidence that these axons, which are the wires in your brain, are starting to get damaged. And we're starting to see that if the axons are damaged, they have decreased amounts or changes in water around them that we can actually see. And we can actually say, yes, we see the evidence of your concussion. And something that Kathy and I have talked about before on, when should an athlete return to play? That's the question at this point. A lot of teams are much more proactive in saying, okay, we're going to have you go through this questionnaire or this testing to make sure you're cleared to play. And a lot of people are cleared to play. And I read an article last night that the incidence of lower leg injuries, like people blowing out ACLs, is way higher in people who have sustained concussions versus college athletes who have not. And the thought is that we release these athletes back to play before they were really ready, before their brain was really ready. And in doing so, their neuromuscular reflexes are not right to stabilize their joints. So that's kind of a tangent. But the point being, this article out of Rochester, Minnesota was pretty profound in demonstrating issues in this part of the brain. And they're saying it's tracing back to blood-brain barrier dysfunction, as well as immune activation to those axons and keeping this whole process going.
I like the tangent. It makes a lot of sense.
Okay, I figured you would, so I threw that in there for you.
Correctly, then it's not sending signals it's supposed to the rest of your joints, muscles, and whatever. And okay, your ACL's storing that. Okay, well, now we've got lots of problems. So yeah, that makes sense to me.
Yeah.
The one thing, as I'm kind of visual. If we're talking about the BBB, what is it? I mean, what's it look like? Is it just how thick is it?
It's actually pretty small. It's these capillary beds, largely in the choroidal plexus of your lateral ventricles, which is where your cerebrospinal fluid is produced. So it's not that big. it's not that huge of an area in all actuality.
Okay.
Yeah.
All right.
Yeah. So, I mean,
So
proportional to the brain tissue.
I mean, what else have we got on the concussion then? From what exactly happens with the BBB when that concussion happens? Do we? I mean, you've already said it, and I missed it.
No, it's okay.
I just didn't catch it.
No, so basically the inference is that if this is a capillary in my brain, and you have all these other things like astroglia grabbing on to the capillary, and then you have multiple of these little hands, so to speak, grabbing on, and even neurons can contact these capillaries. And then you have what's referred to as occludin and zonulin proteins, which are keeping all of these hands together. So they're like baling wire, so to speak, that you would connect one thing with another. And this occludin zonulin protein that keeps your blood-brain barrier together is actually the same protein that keeps your gut barrier together. So your intestinal epithelium is bound by occludin and zonulin. Well, the same proteins are in your brain keeping these guys together. So it's kind of interesting. What is a zonulin toxin? Gluten. Gluten is a zonulin toxin. Now, I can't say that gluten is going to diffuse up to your brain and break down that area, but some people are surmising that. So you have these hands covering the blood vessels, as an illustration, and now you have a head injury where there's a torsional force to the brain. There can be a linear force, there can also be a torsional force. That force to the brain can then stretch the capillaries really quickly at the blood-brain barrier, and it's thought that that then can lead to these hands separating a little bit. Now you get big macromolecules that can start coming into the brain. As I've said before in other videos, if you sprain your ankle blows up and it swells. If you have a head injury, you do not want that amount of swelling in your brain, which is why your immune system in your brain is different from the immune system in the body. So the immune system of the brain is really trying to keep inflammation down. It's trying not to let these inflammatory responses go out of control. This is why meningitis is deadly, because if you get an infection in your brain, it's the swelling in the brain that lots of times that leads to someone's ultimate finality. So with this blood-brain barrier now breaking down, big macromolecules can traffic through. Immune cells from our body can start to get through these gaps, so to speak, in the blood-brain barrier. Now these immune cells start going into the brain, and they start activating more inflammatory responses in the brain tissue. So now your brain's immune system starts getting irritated, like, oh my gosh, well, we got to go into high alert. And this keeps the whole inflammatory process going, which is why in the functional world, some are arguing that you can eat something and it can basically cause a concussion, which seems ludicrous, but it might not be. Because if, let's say, you are a retired professional head impact sports athlete and you're eating let's just say a high carb, high saturated fat diet, which has a lot of gluten in it, a lot of saturated fat. And you're breaking down your gut barrier, because we know every time you eat gluten, your intestinal occludin-zonulin complex is going to break open. Now that inflammation is coming to your body, more inflammation is then going into your brain, and your brain's already turned on to have inflammation going, and all that inflammation is now perpetuating pathological immune responses in the brain tissue, which may be why somebody is still having post-concussion syndrome, or they're later developing some form of neuropathology like CTE. I can't say that's the cause of CTE, but that is one of the theoretical bases for CTE. And I think really, I was thinking about this morning, so let me see here. So I will say, we're going to talk about CTE too. For everybody who's watching, we're going to do a big series on this concussion issue, post-concussion syndrome. I really want to hit all facets of it, and we will get to CTE. But CTE is what everybody's talking about in the head injury world, is what we're seeing most of these retired professional head impact sports athletes suffering with. And is it a continuum? Because it has been found in high school athletes. High school football players who have died, they have found CTE in. Now, was that CTE affecting their brain as bad as it would a 50-year-old individual or a 30-year-old individual who commits some heinous crime? I don't know, but I'm wondering if it is kind of a spectrum through time if it gets worse. And what I just outlined, some people are thinking, is what's driving this whole problem. And one last point on that, Kathy, on that diatribe is that is tau a familiar term for you, Kathy?
Is what?
Tau, T-A-U. Have you heard me talk about that before?
You used it for previously in one of our other talks.
Okay. So tau is a protein that they found in high concentration in the head and the brains and the brain tissue of retired professional athletes and people who have had a lot of head injuries. And you also see tau in things like Alzheimer's. The difference is that the tau accumulation in head injury sufferers who have CTE is lots of times more in the prefrontal cortex and other areas. And there's other things like neuropills and all these other neuropathological findings that you can see in Alzheimer's, but in Alzheimer's is more localized to the memory area. And so they're even seeing now, they're doing studies on mice. I read an article this morning where they're inducing a blow to the head of a mouse, causing a concussion. They're all messed up. They lose consciousness, or they might not. They lose muscle control on one side of their body. And they found that it's the torsional injuries where it's not just a head-on hit, it's when there's a twisting force to the brain tissue. They see tau accumulation almost immediately, like in 24 hours, right at the spot of the injury on contre coup. So, gosh, I'm always backwards in my hand movement with these videos. But on the other side of the brain, there's tau accumulation, and it spreads throughout the brain because of the inflammation. So you'll hear me talk about tau in upcoming videos, and it's thought that maybe the inflammation in the brain is what then causes the tau protein misfolding and accumulation and the consequent problems. So.
All right, and that's kind of what we call that kind of worst case scenario stuff for concussions. I mean, is that as bad as they get? I mean, I've heard you talk about the mom who drops a fork, reaches under the table to pick it up, hits her head on the table, and ends up with a concussion and a lot of symptoms that she's not even aware of later. We have car accident people. There's lots of causes for concussion, but we do seem to, look at pro football players or soccer players or whatever, I guess because, they have continuous injury and something that they're made available to almost weekly. So,
right.
I mean, during the season. So,
right.
That they've kind of become the poster children for concussion and post-concussion syndrome, that sort of thing. So is tau getting into the worst of it because this reacts so quickly? Is it that much more severe?
That's what we're thinking. And the whole tau issue, is usually kind of an end stage problem is what the current line of thinking is. The hard part is, at least I'll dig into research, I have not seen up to date that we have any imaging modalities to specifically quantify tau. So unfortunately, the way tau is discovered is post-mortem, so after somebody dies.
Okay.
So that's why we're limited in our understanding. But I think, a few years ago, it was like 114 out of 115 retired professional athletes who had head injuries had the signs of CTE, which kind of, is pretty scary for a lot of people and what it means for the neurological health of an individual. But I say all that to say a lot of it is thought to trace back to the blood-brain barrier. And then with the blood-brain barrier breaking down, is that the critical factor as to why some people will develop post-concussion syndrome or something like CTE, whereas others will not have post-concussion syndrome, so on and so forth. So I think that. And then one other little element I wanted to add was emphasizing this torsional element to the head impact. The researchers at the University of Rochester, they actually were tracking the football players, and they had accelerometers on their helmets the whole season. And they were able to see, which head injuries were linear, which ones were torsional. The torsional ones seemed to affect that right midbrain more than others. So the midbrain, where is it? It's down here. It's in the brainstem. Well, if you hit the brain gets hit, it's going to create a torsional force, so to speak, like you're wringing a towel, to get the water out. Well, a lot of that force is going to be transmitted through the brainstem. So, and I got to give homage to my mentor, Dr. Carrick, because he's been talking about eye movements and concussions for a really long time. And I would have to say, based on the current research and new findings, he was right on with a lot of this, because he's been tracking the eye movements and how you move from point A to point B as a predictor of concussions. And it's since come out that he was absolutely right. It's since has come out that people with concussions have an increased blink rate. So when they're trying to move their eyes from point A to point B, they blink a lot because they're in your midbrain is a map of your visual world. It's like a grid system. And that grid system can be really disturbed when you have hit your head. So the neurons kind of rewire themselves. So now you may think something is out here, but it's actually here. And think how impactful that is for a baseball player who had a concussion. And now they're, trying to hit a ball, or a hockey player who has this stick and he's got a puck, 4 or 5 feet away from him, that he has to figure out how to hit that puck. And if his brain is not coordinating the visual information correctly, then that can create an issue.
For sure.
Yeah.
Okay. Is there any bleeding with a concussion?
With a concussion,
or is it all just swelling?
It's just like micro swelling. We can't even see the swelling on a macrostructural view of your standard MRI scans, which we'll get into, MRIs and CTs. Basically, we do those to look for bleeds like hemorrhages, subarachnoid hemorrhages, which can be life-threatening after a head injury. So that's why we do the imaging. But with a concussion, there isn't really gross swelling per se.
Okay.
Yeah.
All right. All things we need to know.
Okay. Any other thoughts you had, Kathy? I think I kind of went on there a little bit long, so I didn't want to.
No, I think this is very helpful. I think it's a good time of year to bring it up. There's a lot of football and soccer and stuff being played right now. So for our young athletes, especially if people are paying attention, I know there are better helmets being made all the time for football players and so forth. But people get bigger and hits get larger and people get hurt. So being aware of it, paying attention to it, making sure they're documented and that people are watched and that the symptoms are paid attention to, I think is the biggest thing. Don't overlook them. If you're throwing up, if you're dizzy,
right.
That sort of stuff, you need to be seeing somebody. You need to be telling somebody. Don't think you're just going to, like you always say, walk it off.
Right.
You don't walk it off.
Yep, exactly. Walking it off can be productive, I think, in certain circumstances, but not in this situation. So yeah, not for head injuries. Okay.
When you talked about the sprain ankle, it does not help the sprain ankle. It only hurts.
Exactly.
It does not work at all. So there's only certain things you can walk off, and getting beamed in the side of the head with a baseball coming like 120 miles an hour in the temple is something to be looked at.
Yeah, I would say so. For sure.
So
oh boy.
Don't walk it off. Tell somebody, get looked at, and pay attention. It's only smart. I mean, then we talk about this every week. Health is our thing, and you're just trying to make people more informed, and I appreciate it. Thank you.
100%. Well, thank you, Kathy. So we'll be back next week with something else on head injuries, why post-concussion syndrome. And if you have any thoughts or questions, let us know. We had a question about seizures, Kathy, and temporal lobe scarring. I'll probably try to get to that next week. And yeah, thank you everyone for watching. We could
do a whole show on that sort of stuff.
Yes, we could, for sure.
Okay.
So for all of you, share this video if you want to. I have to say all that stuff, and we will see you next week. Okay, bye-bye.
Goodbye.
Here, and that one, and this one.